Welcome to the Dr. Dean Show today. And today we've got a special guest, and we're going to be talking about a couple of diagnoses that we deal with a lot at our clinic, ASD and ADHD.
Dr. Dean Beckloff has been working as a counselor with students, families, kids, and teens for over 40 years. As the founder of the Beckloff Behavioral Health Center, Dr. Dean focuses on children and families that need a little extra help via counseling. Each week with Dr. Elizabeth Zach, we discuss all things family related to help people create the positive family they want to build. Welcome to the Dr. Dean Show.
Okay, welcome to the Dr. Dean Show today, and we have joining us today our always wonderful, beautiful, licensed psychologist, Dr. Elizabeth Zach, and we'll be learning a lot from her today. And then we have a special guest too, who is really, he's been here quite a bit. He's a frequent flyer. So we're glad to have Dr. Graham Martin, a licensed psychologist as well. He and Dr. Zach both work not only with kids who are on the spectrum and ADHD as well as adults, but they are also involved with our testing program as well. And they are people who I consider to be experts in this field. So welcome to both of you. We'll be getting this up on our website at www.drbecloff.com, DRBECKLOFF.com, and you'll be able to watch that there as well. So let me just get started. And we hear a lot about neurotypical, neurobiological uniqueness and differences. And that's really what I consider this to be, ASD, ADHD, that those are unique ways that people come built on the planet. And we all are unique and we all come built uniquely. So what is ASD, Dr. Martin? What's your, I guess, your definition, maybe a core definition, and feel free to explain more about that.
Sure. Well, as you said, it's a neurodevelopmental disorder, which means it's diagnosed in childhood usually, and it's called the autism spectrum because there's a wide array of strengths and weaknesses. But it really captures two different core areas of challenge, which relate to social communication and restricted repetitive behaviors.
Right. Yeah. So I actually did my research for my doctorate on autism. Mm-hmm. At the time, there was very little known about it because I'm very ancient and old, and I wanted to learn more about that. I was beginning to have kids coming in that were unique and different, and so I actually had a kiddo that we finally did diagnose as autism. I think we put NOS at the time, not otherwise specified, but we don't really use that anymore. However, I wanted to learn as much as I could about that whole arena, feeling like I could really get into this. But, even back then, the research was pointing to the fact that it's a spectrum. It's a spectrum of differences. Mm. So what are some of the differences that make it a spectrum? The research, like I said, was pointing to that. It's finally now called autism spectrum disorder. What is it that makes it a spectrum?
Mm-hmm. Well, functionally speaking, there's a large variability in presentation and functional ability. So you could have somebody who has been diagnosed with autism, who you wouldn't be aware of or identify, right away, or even somebody who you may have known for years.
Or by observation.
Yeah. Could somebody you work with, or even a friend, and if they say, "Hey, I was diagnosed with autism," you might say, "I guess that makes sense," or I can see what you're saying now. And then on the other side of the example is a classic example like Rain Man. Somebody who has severe functional impairment, and also has intellectual impairment and some pretty severe speech difficulties too.
And that was the thing that I was intrigued by in the research, is that it was already pointing to it was a spectrum of differences. So not only is it a spectrum of unique differences, and I'd
Mhm.
love for you to talk a little bit about what that can be at times,
Mhm.
like a spectrum of differences, and but also a spectrum of intensity, if I can put it that way.
Mhm.
We have a way of measuring that. I mean, I don't know that it's completely a pure measurement, but we have a way of trying to measure that. What about that spectrum and the two kind of sides to that?
Mhm. Yes. So the spectrum that you're referring to relates to social communication difficulties and also restricted repetitive behaviors. And there's a spectrum of both of those. So anything from difficulty socializing, difficulty engaging in reciprocal communication, um, challenges reading the room, and just picking up on social cues, um, difficulties with eye contact,
Yes.
pragmatic language.
I was always intrigued by the sensory differences,
Mhm.
that the auditory sensitivities, or I had a kiddo who was sensitive visually. We don't often see that, or it's a little bit more masked, but visually, he would freak out when he saw a picture
Mhm.
that was different and uncomfortable
Mhm.
because it was slamming into his senses.
Mhm.
Had a kiddo who one time he was in second grade, and he his teacher asked him to turn to a certain page, and when he got there, he slumped to the ground, fainting. He was in a dead
Mhm.
faint, and when they finally got him awake, he was like, "The troll, the troll." There was a picture of a troll, and it just assaulted his senses. So, anything you can speak to that as well? I feel like we have learned
Mhm.
about sensory differences in all kids as a result of our kids on the spectrum.
Sure. Yeah. Auditory sensitivities, visual, um, you know,
Texture,
te-
there's taste.
Taste? Oh,
It's big.
yeah.
absolutely.
The
Um,
eating.
Mhm.
And what was so cool is I could recognize that in my kids too.
Mhm.
I also recognize my sensory differences as well, but especially when I was younger and growing up and realizing, oh, I have that too.
Mhm.
I
Yeah.
think there can be
And now I just tell my wife, it's a sensory thing, honey. Leave me alone.
Yeah.
hypersensitivity, but there also can be like hyposensitivity where, kids
Sure.
are craving that touch or that
Mhm.
the feel of certain things.
Yeah.
Mhm.
Yeah. And so out of that, of course, came the weighted blankets.
Mhm.
I think we learned a lot from Temple Grandin with
Mhm.
regard to that need that
Yeah.
she had,
Mhm.
that she learned from cattle.
Mhm.
So I thought that was always fascinating to me. Um, Dr. Zach, what about early signs of autism or ASD in children, and maybe signs in adolescents as well? I mean, we do assess at our clinic for ASD. And so, we are looking at sometimes very young children, as well as then adolescents. I think it's a little harder in with young children because if I can use the word spectrum in a different way, spectrum can be there's a wide variance in young children about
Sure.
appropriate and expected behaviors, but then
Mhm.
those kind of fall away. So, what about maybe some early signs in childhood and then in adolescence as well?
Sure. You know, in toddlers, and we don't want to overinterpret, like you're saying,
Yeah.
because some of these things are resolved. But in toddlers, sometimes we can see limited pointing, limited gestures, less response to their own name. Sometimes, we see it present with limited kind of pretend play where a young child often takes an airplane and is playing with the airplane. We know that they're pretending to be on an airplane. With kids on the spectrum at times, that is a bit limited.
You may not see the
You may not.
the pretend kind
Right.
of stuff as
Right.
much.
Yeah. Yeah. preschool age, we might start seeing some delays in language. We might see more parallel play, less interactive. They're playing next to a child, but not really interacting or playing with the
Yeah.
child. We can start seeing, some rigidity in the way that they're doing things. Sometimes the
And
people things the
that's an
same
important
way.
one,
Yeah.
that inflexibility.
Inflexibility,
Yes.
difficulty with adjusting. Um, and then school age, we start to perhaps see some social misunderstanding, not knowing kind of
yeah.
how to, do the reciprocal back and forth. We can, see at times more of those intense interests that you were talking about. So, my boys when they were young. I had one boy that was always planes, trains, and automobiles. He was a transportation kid. And then my other child was a dinosaur boy. You knew all about dinosaurs, but it wasn't restricted to just those things. I
Yes.
think all kids have interests,
Mhm.
specific interests, cars or dinosaurs or whatever it may be. But school age, when we're kind of seeing some flags for autism, it's a restricted. They know every detail, and that is kind of their one thing, or they know everything about sea creatures or
Mhm.
Pokemon characters.
Exactly.
Yeah.
And
Mhm.
what was so intriguing to me, I had kids too. One of the things that's interesting,
Mm.
all boys like transportation stuff, wheels.
Yeah.
And but these boys would get fixated on only that.
Right.
And with one of my kiddos, there was not a lot of pretend play.
Mhm.
It was lining up those cars in the
Mm.
sandbox meticulously and I guess rigidly, if I can put it that way, that it was always the same way.
Right. And then upset if it was
Oh, yeah.
out
Yeah.
of the way that they wanted it set up. If, mom or dad or somebody came and moved those toys.
Yes,
Yeah.
exactly.
And then I think in adolescence, often if we're at the age of adolescence or even adults, it's been or it's been underdiagnosed, or it hasn't.
It's been missed.
It's been missed.
Yeah.
Yeah. And so we can sometimes see, social fatigue. We can see perhaps a difficulty in the school environment, difficulty in the work environment for our adults. We have social sensory overload,
Yeah.
overwhelm, and often these folks will describe that they've always felt different.
Yeah.
Yeah.
They just knew something was different.
This may be before your time because I'm old, but it used to be believed that the diagnosis that was called Asperger's syndrome was not identifiable until adolescence,
Right.
And yet that fell by the wayside because then we began finding kids who were Asperger's younger than that, and then realized that's where the whole spectrum idea came in, I think, was that no. And so I would say,
Mhm.
I don't know if you believe this, Dr. Martin, but I would say that Asperger's now would be probably more like level 1 ASD.
I'd say so. Yeah.
Okay.
Low need. I think we
Mhm.
now have, these levels, level 1, level 2, level 3,
Mhm.
and really it's kind of based on the amount of support or the needs that the child or adolescent or adult may
Yeah.
have.
But these
Yeah.
kids, like you said, were missed until they got to teenage years, and then the social, emotional issues were showing up. I hate to put it this way, but a little bit more glaringly.
Mm.
And so then realized there's a problem here.
Right.
And so I think, let me ask you, is it important to understand what's going on with the child as young as we can? Dr. Zach?
I
Well-
think so. Early intervention, I think, can be so helpful for these kids and
Mhm.
parents to have that education, whether it's, getting them into, some different therapies, getting them some support at school, and we can talk about that a little later. But absolutely, I think early intervention is really helpful.
Yeah.
Yeah, it all comes down to practice and support. So the earlier you identify it, the more practice and support you can receive. And it takes time. It takes time to build social skills and cues that might seem intuitive to someone more, or more typically functioning. But yeah, if eye contact doesn't come naturally to you, it takes practice. If shaking somebody's hand doesn't come naturally to you, then it has to be drilled down.
And to some extent, what I've read in the research too is that these kids are going to benefit, I hate to say this, from maybe some rote kind of drill and practice.
Sure.
Not necessarily. There has to be that human element of interacting, which I'm a big believer in for kids who are on the spectrum. But that practice makes perfect in things like eye contact. Also, the social give and take. And if we can get there early enough and begin building the language and the skills, that's going to be helpful. So absolutely. Are there gender differences that we can see in terms of male and female representations of
There are. I mean, there's certainly overlap, and these aren't hard and fast rules. But, typically, I think it has historically been easier to identify boys who are on the spectrum. I think we're getting better and better at identifying females on the spectrum and diagnosing that earlier. But, oftentimes girls may be less disruptive, more and more capable of seeming to go with the flow. Also, there's some of the intense interests can vary. So where, you might think of a boy being fixated on electronic trains.
Yeah.
And that's all they talk about. They know everything about it. They're experts. Girls may be interested in, for example, animals, stuffed animals, real animals. There might be a higher level of empathy, or it may seem so. And there might be more emphasis on perfectionism and greater attempts to mask and blend in with their peers.
Yeah.
For females.
Okay, so I have 6 grandchildren. Most of them are females. One of them has now been diagnosed as being on the spectrum. Light. Level 1, and doesn't need a lot of support, and you might not even know and be aware of it, but she's female, and so later down the road, it was more, okay, we're beginning to see some things here that began to make some sense.
Yeah.
And I'm not a big one for labeling. I don't like labels on anyone, but once, someone once said, diagnosis is not about trying to put someone in a hole or pigeonhole them. It's about trying to understand people better. So even psychological disorders like narcissism and all that, those get tossed around these days, I think, a lot. But the intent was to help understand a person. So the same thing is true for kids on the spectrum. It's a way of understanding, and then we can intervene more effectively, knowing what some of the issues are typically going to be. Like social is one of them. Being aware. I mean, that granddaughter is very intelligent, of course, and all those kinds of things, but there's some social implications that come with it, and so we can intervene early. So, what is masking, Dr. Zach? Now my oldest daughter hated masks. She was petrified of masks, but So, is this something that we need to put on? Now, I wear a mask all the time.
We all wear masks
Socially, yeah.
to some extent,
Yeah,
right?
yeah.
Masking, when we're talking about autism, it can be conscious attempt or unconscious attempts to hide some of these autistic traits in
Oh,
order to fit in.
yeah.
So you were talking about kind of the learned, it could be learning how to shake a hand, or
Mhm.
becoming comfortable with that. It could be, I have a adolescent who is very uncomfortable with eye contact, but she told me that now she just stares at the bridge of somebody's nose, and that's a way to kind of
Oh,
mask,
how cool.
right?
Yeah.
Yeah.
It could be rehearsing conversations, kind of learning a social script. It could be copying peers' behaviors. You see what your peer is doing, and so attempts to sort of copy so that they're fitting in. The problem with masking, there's a psychological toll, I think, that it can have.
Right.
Just exhaustion, right?
Mhm.
When
Yeah.
you're trying to read the room and seeing what others are doing to fit in, there can be anxiety and depression, worries about, am I doing it right?
Mhm.
Or, who am I even? Am I the mask, or am I, something different? And so it's something that we see often in females,
Mhm.
but certainly, in males too. But I think it can, particularly in females, cause a later diagnosis
Right.
because of these attempts to
Yeah.
mask, and then we miss it, earlier in childhood.
Exactly.
Yeah.
Oh my word. And I was thinking about the fact that most of our kids, I
Mhm.
don't care if they have a diagnosis or not, most of them are trying to do a pretty good job at school. And so what happens when they get home? They are worn out.
Yeah.
Yeah.
They're tired. They're done in.
Mhm.
And especially these kids with ADHD or ASD, they've been working hard to keep it together as best they can, even though they may
Mhm.
not have always been
Mhm.
successful that day.
Mhm.
Mhm.
They have
Mhm.
mental
Mhm.
tiredness
I describe
happens.
it to parents. It's almost like during the school day, they look like a duck just gliding across the pond, but
Mhm.
underneath they're paddling like crazy, and we don't see
Oh, yeah.
that. But then
Right.
at home, they're just spent.
They're spent.
Mhm.
Yeah.
And then, of course, who is dealing with the tantruming,
Mhm.
the anger, easily angered? Already, these are kiddos that are going to have a harder time managing emotions. They're
Mhm.
gone. They don't have anything left.
Yeah.
Very difficult.
Yeah.
I know we don't have time to get into all of that, but one day we need to talk about ways to help with all kids, and then perhaps especially these kiddos that have some neurotypical uniqueness and differences.
Mhm.
Dr. Martin, how do you evaluate ASD?
Well, there are different objective measures. It, it it is a difficult thing to assess. I think we're getting better and better at it. Um, but a combination of obtaining accurate and comprehensive historical information from parents, from teachers, also utilizing uh, questionnaire evaluations from parents and teachers to get some objective data points on, where the concerning behaviors really fall relative to a broad normative sample. So, how significant is the emotional dysregulation?
Yeah.
Not just compared to, older brother, but like most 10-year-old kids, across the nation. And then face-to-face evaluation interactions, where we're taking very detailed notes about every little aspect of the interaction,
Mhm.
from eye contact to how one responds to frustration, to how the conversation ebbs and flows, all the way to what's the child doing if it seems like you're not paying attention to them, which is one of the harder ones. If I'm, attempting to gauge that, then, it kind of doing something else, maybe scoring something and just seeing, okay, is the child gonna say, "Hey, Dr. Martin, over here, what are we doing next? Hello," or will they sit there for 5 or 10 minutes without saying anything?
Right. Right.
Or I love the, bumping your leg on the table, right, and saying, "Ow," and just seeing if the kid responds.
Yeah.
Yeah. Or if they're just, if there's no response. Yeah.
Well, I had
Yeah.
a doctor friend of mine, and I heard him say this one time, and it just stuck with me, and it just made so much sense to me. I know we do. We always put in, obviously, an IQ test. Generally, the WISC is one that we use. It's a very, very good, excellent tool for understanding and assessing intelligence. But we're not really looking at it always about intelligence, because he had this phrase called islands of intelligence. And I always thought that is such a good way to put it, because you just recently had a kiddo who tested that way. There were some real variance on the IQ test,
Right.
but he had several areas that were very high, which kind of corresponded to what I would think would be islands of intelligence. So, Dr. Zach, anything that you would add to the testing format and what you're kind of looking for?
Well, I think in general, like you were saying, it isn't one test. We're looking at
Absolutely.
patterns, right? We're looking at, even within like the IQ test that you were mentioning, that variability is often present. We're not looking at, a single test, but the diagnosis really requires, all of the observations, the parent report, teacher report, the observations that we have, and then along with, the objective testing that we do.
Right.
Yeah.
And then time flies when you're having fun. What about supports and interventions that are available out there?
We were talking about early intervention is great. I think there are so many different supports for families for these kiddos. A lot of times we'll refer to occupational therapy if there are some sensory differences or sensitivities.
And physical differences too, because sometimes that's a part of the whole spectrum. Yeah.
Absolutely. There could be, motor coordination difficulties, and, occupational therapy can be great. Speech and language therapy.
Absolutely.
To kind of hit some of that pragmatic language, learning how to, the back and forth of conversations.
And our speech and language therapist at our center does a lot of work with our kids on the spectrum, helping them to learn that social language.
Right.
Yeah.
Right.
Sorry, go ahead.
No, she does a great job. Yes. I think speech and language is wonderful for these kids. There's behavioral supports. ABA is one of those, applied behavior analysis, to work on some of the behavioral difficulties. In school, we might have 504 or IEP plans with accommodations. A lot of these kids, may require or could benefit from fidgets or noise canceling headphones. If there's some sensitivities there. Maybe, testing in a quiet room, different kinds of things that school can provide. I think for parents, learning about the diagnosis, helping parents with providing, predictable schedules for the kids. It could be, sensory supports, clear communication. So I think there's a lot that, these kiddos can really benefit.
And a lot of the schools now, especially high school and middle school, but they are getting there in the lower schools too, have a social skills class for these kids to be working on that, which is so incredibly important when you're in middle school and high school.
Yeah.
What about differences between ASD and ADHD, Dr. Martin? I went to a school district meeting one time, and in my opinion, the kiddo was very much ASD.
Mhm.
Then the school district had done testing and they were like, no, we kind of think he's more on the ADHD side and not the ASD. And there was a long discussion. And later, mom told the school district that she would sue if this wasn't fixed. They said, okay, he's ASD. So, but there could be some overlap, right?
Certainly. And there's an amount of comorbidity in the diagnoses where, if you're on the autism spectrum, you're a lot more likely to be diagnosed with ADHD. The inverse
And
isn't.
attentional issues are a lot of times there, right?
They are, yes. I think, the hyperfixation can detract from attention on some, more appropriate areas of attention that might be needed.
Yeah.
So, like at school, if you're voraciously reading Harry Potter underneath your desk, like you're paying attention, but just not to the teacher and not to math. Whereas, somebody with ADHD might be, bouncing around or just zoning out in general, not because they're hyperfixated on something else. There's overlap and challenges with emotional regulation.
Absolutely. Yep.
Yeah, and I think the driver behind that can be different across the two, but yeah, less of an executive functioning impairment for kiddos with autism. But yeah, there's the Venn diagram is pretty vast. I think we could spend the whole show talking about that.
Oh, we could. I mean, I know that a lot of our parents are very familiar with emotional dysregulation.
Mm-hmm.
We need to talk about that stuff. And that can come from a lot of different sources, but emotional dysregulation, and I've often told many parents, you will have no hair left. That's what's happening to me. You will have no hair left. So again, thank you for being with us. We could just talk about a lot of these arenas. Send us an email. Let us know what you think about any kind of areas that you'd like to know more about. Again, you can go to our website, www.drbeckloff.com, or you can also call our office at 972-250-1700. Thank you so much for being with us, and we look forward to our next Dr. Dean show.